So in this video we'll be doing next question on cystic fibrosis, and the first thing is explain how two parents who do not have CF may have a child with CF. The first thing, CF gene, CFTR gene responsible for CF is recessive normal defected, or we can say defected SFTR gene, which is responsible for is a recessive allele. Okay, so the parents can be the holders of this defected gene, and so they can produce one out of a 4 child who is defected. Okay, if both the parents are holders. So that's what they can see. Parent heterozygous carriers, SF allele recessive, so child homozygous recessive. Okay, you get your child as homozygous recessive. You get your 2 marks. Okay, so you have to specify that your child is homozygous. That your child is homozygous recessive. Okay, you have to specify that. Okay, then describe 2 ways in which CF affects the lungs. Cystic fibrosis affects the lungs. We have to describe 2 ways. So probably there is thick mucus, right? So thick, sticky mucus produced. That's the first point, and that's the most important point. And then mucus not moved effectively by cilia accumulates. Okay, reduced gases exchange, longer diffusion pathway, difficulty in breathing, infection, traps bacteria, lungs are scarred. So this whole thing comes from the mucus being sticky. Okay, so the first point you should be writing here for any CF question for that case is that first thing happens is mucus is sticky, right? That's the most important point. And then if mucus is sticky, what does that imply? That implies that if mucus is sticky, there will be more infections. The mucus is sticky, it will be trapped. Okay, mucus will be trapped. That's what they say here. Mucus not effectively moved by cilia. Okay, so mucus not moving. So we have to write that mucus not moving, not moved by cilia. Okay, by cilia. So hope the point is clear that mucus is not moved by cilia. And then if mucus is not moved by cilia, what does that imply? That implies that this will have a reduced gaseous exchange. There will be a reduced. Now this is the first effect actually. Reduced gaseous exchange. Okay, there will be a reduced gaseous exchange because now the air cannot pass on. Okay, because the mucus does not enter, and there will be infections. Bacteria traps. This mucus traps bacteria, as you can see here. Infection, bacteria traps bacteria. Mucus traps bacteria. Mucus traps bacteria. mucus bacteria, and difficulty in breathing. Okay, reduced gases exchange, so this will lead to breathing difficulty. So hope that point is clear. And then we go to the next point. So one potential way of treating CF is by using gene therapy. Outline with the reference of a cystic fibrosis what is meant by gene therapy. So gene therapy means a process of removing the faulted gene, okay, so the faulted recessive gene, removing the faulted gene therapy is to remove the faulted allele, replacing, not removing actually, replacing faulted allele of the gene, faulted allele of SFTR with normal allele, okay, with the normal allele. Here we can see alters genotype, insert normal allele into affected cell, use a vector, name vector, use recombinant DNA. Now there are more details given that how this process. Now this is the thing that takes place. We replace the faulted allele of SFTR with normal allele. But now, since we are talking about gene therapy, we need to talk about gene technology a bit. Okay, we need to talk about genes over here, how this is actually done, how does the process take place. So we can say that how is this replaced? There is an infected, this one is damaged, or what we say, okay, affected cell. Okay, this is affected cell. Okay, you enter a vector. You enter a vector. You move a vector to carry the and the vectors are given here actually. This one, the vector can be AAV 2.5, okay, it can be AAV 2.5T. so you can have your vector, okay, AAV 2.5T, AAV, this can be vector to carry the gene you require. So this will carry the gene, carry the allele, okay, to the infected cell. Okay, and the recombinant DNA. So if you mention only 2 points over here, you get your marks. Okay, and you should know that this gene therapy will work to alter genetic constitution, right? It should alter the genetic makeup, alter genetic makeup, right? So hope that was clear, and now we will continue with the next theme. Next two questions tells us that describe one possible advantage and one possible disadvantage of using gene therapy to treat cystic fibrosis. So an advantage can be you can treat, okay, treats cause no symptoms, no physiotherapy needed, no antibiotics, less time consuming than other treatments. So less time consuming. Disadvantage: effects only last for few days, low uptake of target cells, only target lung cells present. Side effects. So we should know that this one has side effects. The disadvantage: so gene therapy, in this case, the gene therapy used has side effects. Okay, they have a few days. Okay, just few days. Okay, and then only target lung cells. Okay, only targeted cells are altered, not other ones. And then the advantage: treat cause no symptoms, no physiotherapy needed, less time consuming. So advantage, you can say that good things are that treats. So the good thing first is that it actually treats, and then no antibiotic, and then less time consuming. Okay, so these are very important points. So hope that I made myself clear, and hope to see you in the next video. Thank you for listening.